Chlorpheniramine is a histamine H1 receptor antagonist indicated for the management of symptoms associated with upper respiratory allergies. In this video, let's find. What is chlorpheniramine? What is chlorpheniramine used for? Contraindication. What are the side effects of taking chlorpheniramine? How does chlorpheniramine work? How to use chlorpheniramine? What is chlorpheniramine? Chlorphenamine, also known as chlorpheniramine, is an antihistamine used to treat the symptoms of allergic conditions such as allergic rhinitis. It is taken orally. The medication takes effect within 2 hours and lasts for about 4 to 6 hours. Common side effects include sleepiness, restlessness, and weakness. Chlorpheniramine was patented in 1948 and came into medical use in 1949. It is available as a generic medication and over-the-counter. What is chlorpheniramine used for? For the treatment of rhinitis, urticaria, allergy, common cold, asthma, and hay fever. Contraindication. Hypersensitivity to chlorpheniramine or any component of the formulation, narrow-angle glaucoma, bladder neck obstruction, symptomatic prostate hypertrophy, during acute asthmatic attacks, stenosing peptic ulcer, pyloroduodenal obstruction. Side effects. The adverse effects include drowsiness, dizziness, confusion, constipation, anxiety, nausea, blurred vision, restlessness, decreased coordination, dry mouth, shallow breathing, hallucinations, irritability, problems with memory or concentration, tinnitus, and trouble urinating. Chlorphenamine produces less sedation than other first-generation antihistamines. Pharmacodynamic. In allergic reactions, an allergen interacts with and cross-links surface IgA antibodies on mast cells and basophils. Once the mast cell antibody-antigen complex is formed, a complex series of events occurs that eventually leads to cell degranulation and the release of histamine and other mediators from the mast cell or basophil. Once released, histamine can react with local or widespread tissues through histamine receptors. Histamine, acting on H1 receptors, produces pruritus, vasodilatation, hypotension, flushing, headache, tachycardia, and bronchoconstriction. Histamine also increases vascular permeability and potentiates pain. Chlorpheniramine is a histamine H1 antagonist, or more correctly, an inverse histamine agonist, of the alkylamine class. It competes with histamine for the normal H1 receptor sites on effector cells of the gastrointestinal tract, blood vessels, and respiratory tract. It provides effective, temporary relief of sneezing, watery and itchy eyes, and runny nose due to hay fever and other upper respiratory allergies. Mechanism of action. Chlorpheniramine binds to the histamine H1 receptor. This blocks the action of endogenous histamine, which subsequently leads to temporary relief of the negative symptoms brought on by histamine. Half-life. 21 to 27 hours. Dose. Allergic rhinitis. Tablets or syrup, 4 mg, POQ 4-6HR, not to exceed 24 mg per day. Extended release tablets, 8 mg, POQ 8-12HR, or 12 mg Q12HR, not to exceed 24 mg per day. Extended release capsules, 12 mg, POQ day, not to exceed 24 mg per day. Sustained release capsules, 8 to 12 mg, POQ 8-12HR, up to 16 to 24 mg/day. Safety advice. FDA Pregnancy Category B, no proven risk in humans. That's all the information about chlorpheniramine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.